I'm going to be your nurse today. Wash my hands. What's your name?
Angela.
Angela. And what's your date of birth, Angela?
April 15th, 1964.
I'm going to have a seat by you for a second, okay? Do you mind if I check your wristband? Perfect. I'm going to ask you a few questions, okay? What brought you in to the hospital?
I don't feel very good. I've just been real tired and I've been coughing for about 3 days and just kind of short of breath.
Okay, about 3 days. All right. Can you tell me what hospital you're at right now?
Marion.
Okay, very good. Do you know what month it is?
January.
Okay, great. How about, do you know who the president is?
Right.
Wonderful, thank you. So what I'm gonna do is just kind of talk through kind of what's going on with you, do an assessment so we can figure out how things look right now and what we can do to best treat you and hopefully get you feeling better, okay? So we've done your vital signs. Looks like you are running a little bit of a temperature. Your heart rate's a little bit elevated, maybe a little bit O2 sats are a little low too, okay? So we're gonna figure out what we can do to make all that better. When you cough, are you coughing up anything?
Yeah.
You are? What's it look like?
It's just real nasty, green.
Okay.
Greenish yellow.
Are you having any pain?
A little bit on my leg. I kind of fell when I got up last night and I hurt my leg. They put a bandage on it. Doesn't look bad.
Okay, I'll make sure I take a look at that. How would you classify the pain? Like sharp, dull?
Just
Can you
bruising.
describe it? It's more like bruising. Okay. On a scale of 1 to 10, how would you rate it if 10 was the worst pain you've ever experienced?
Probably like a 3.
A 3? Okay. And does anything make it better? Make your pain better?
On my leg? Or
Yeah.
just in general?
And in general too.
They gave me an aspirin and I think it might have helped just a little bit.
Okay. Regarding pain anywhere else, are you having any other pain besides your leg?
Just discomfort.
Just like, is it, I see you grabbing here, is it your chest?
Yeah.
A little bit in your chest?
Yeah.
Okay. All right, so I'm gonna go ahead and start my assessment if that's okay with you, all right? I'm gonna raise your bed up just a little bit, okay? All right, first thing I'm gonna do is I'm just kind of taking a look at your face and making sure everything looks symmetrical and that I don't see any bruising or anything that looks like it's out of the, out of normal, okay? Next, I'm gonna look at your pupils. So I'm gonna have you stare straight ahead at the wall, okay? I'm gonna shine this light in your eyes. You keep staring forward for me, okay? Great. And what I'm looking for is that your pupils constrict with the light and that they're equal and they're doing the same, they're equal and both pupils are doing the same thing, okay? Now I'm gonna have you just look at my pen light. You just stare at my pen light and I'm gonna bring it towards your nose. Good. I'm just making sure that your eyes can follow and track together, okay? So that's great. All right, I'm also gonna have you open your mouth for me. Wonderful. Taking a look at your mucous membranes, making sure everything looks okay, all right? Next thing I'm gonna do is go ahead and listen to your heart, all right, and then your lungs. I'm gonna start with your heart, all right, and you can just breathe normally, okay? All right, starting with your aortic valve. I'm gonna move your your gown just a little bit. Atomic valve. Come down. Yep, thanks for having you move your arm a little bit. Good. Tricuspid valve. And then mitral valve. Good. And I can hear that your rate is a little elevated, but your rhythm is consistent. I don't hear any abnormal sounds there. Okay, next I'm gonna listen to your lungs. I'm gonna start with the front, and whenever I move my stethoscope, I'm just gonna ask you to take kind of a deep breath for me, okay? All right. Down on your side. I'm just going to move your arm a little bit. Alright, so take a deep breath. Thank you. And we'll do the same thing on this side, okay? Alright, good. So while you're in this position, I'm going to go ahead and look, listen, and palpate your stomach, okay? I'm going to put the head of your bed down just a little bit, if that's alright. Is that comfortable? Alright. Okay, so I'm just gonna pull this down a little bit. Do you mind if I pull your gown up? Okay. Alright, perfect. Alright, so observing, I don't see any distension or any bruising or anything like that on your stomach. Now I'm just gonna go ahead and listen, starting with the lower right quadrant. Good. Now I'm just going to go ahead and gently press on your stomach. Just let me know if anything is uncomfortable or causes any kind of pain, okay? Good. Everything's soft. That's great. Okay. How has your appetite been? I'm going to go ahead and put your head back up for you.
Not very good. I haven't been able to eat hardly anything.
Have you been nauseous or having any vomiting at all?
No, I haven't vomited, but it doesn't sound good.
Doesn't sound good?
It doesn't sound well.
Okay. Do you remember, could you tell me please when your last bowel movement was?
I don't know, maybe the day before yesterday.
Okay. And how about urinating? Have you been able to urinate normally?
I have, and last time I noticed it was really dark, like
Okay.
dark gold or.
Okay. Have you been able to keep fluids down? Have you been drinking?
I have probably, I don't know as much, I just feel tired.
Once again, just kind of don't feel.
Yeah.
Food and drink don't sound great. Okay. Next thing I'm going to do, I'm going to take a look at your skin and your arms, okay? So I'm just going through your skin is warm and dry. I'm going to check skin turgor. That helps us know, and it's less than 3 seconds. That helps us know about dehydration. I'm going to go ahead and check your cap refill since you have your nails painted. All right, good. And then I'm going to do the same thing on this side. Everything looks good. Cap refill. Checking your IV site. Is anything painful? Nothing's bothering you with IV. Okay, it looks dry, intact, clean. I don't see any signs and symptoms of any infiltration or anything. Now I'm going to have you squeeze my fingers. Okay, with both hands. Good. Does this feel the same on both arms? Okay, great. I'm going to have you pull your fists up towards your elbow. Good. All right, and now don't let me pull you down. Push against me. Awesome. Very good. All right, that all looks good. I'm going to move down to your legs, okay? So I'm going to go ahead and move the sheets if that's okay. All right. Okay, very good. Once again, we're taking a look at skin. I'm checking for any edema. I'm going to go ahead and take your socks off, okay? All right. And I see where that wound is. The dressing looks dry and intact. So that looks good, but definitely see where you got that wound. I'm going to check pulses in your feet. I'm going to take this one off too. Check both extremities for any edema. I'm going to check pulses bilaterally and cap refill. Any numbness and tingling down here? Does this feel the same on both legs? I'm going to have you pull your toes up towards your head. Don't let me pull you down. Good. And then push Good. And I'm gonna check these pulses too, make sure I get all your pulses. Good, and all your pulses feel strong and good. All right, we'll go ahead and put your socks back on when we're all done, okay? All right, now are you able to sit up for me? Okay, are you doing that? I'm gonna have you sit up. You doing okay?
Yeah.
All right, I'm gonna have you sit up. I'm checking your skin on the back just real quick, and then I'm also gonna listen to your lung sounds in the back, okay? So once again, when I move my stethoscope, you take a deep breath, please. All right, and go ahead. Nice deep breath. Good. All right, then I'm gonna come down here. Deep breath for me. Good. And on this side, deep breath. Okay. All right. Okay. Thank you for letting me get through that assessment. Is the bed comfortable where I have your head?
Yes.
Okay. Do you have any questions for me? Okay, is there anything that I can get you? Is there anything that you immediately need? Anything I can do to make you feel better in the moment here? So what the plan will be is I'm going to go back, chart all my findings, and then come up with a plan, and we'll do some interventions. With your O2 sets being a little low, we might consider some supplemental oxygen potentially. I did see in the ED you had some Tylenol to help with your fever, so we'll reassess that and where we are with all that, and we'll just do what we can to get you feeling better soon. Okay? So I will be back soon. I'm gonna make sure I put your bed all the way back down. Your side rails are up, and you're gonna have a call light right here, and we'll get your socks back on you, and I will be back. Push the call light if you need anything, okay?
Okay,
Thank you.